here from Simply Physio. I'm here with Dr. Steven as well. We got our tip here for the week. We've been focusing on knee pain here the past few weeks. And a few things that we look for here in the clinic when somebody has some knee pain is how is the knee moving? And in the previous video, we were showing the knee internal rotation. How well can your knee rotate in? So another key movement that we find here that a lot of people can lack is their ability to fully extend or straighten the knee. And when you can't fully straighten your knee, in essence, it'll give you a short leg, and it'll throw off just the whole mechanics of how you stand, how you walk. And it's a key piece that you need to have restored so that you can move well and help to heal from any type of knee pain. So I'm going to have Dr. Steven demonstrate just an assessment technique that you can look for and how we go about correcting it, and give you a few tips as well on what you can do to help with the issue as well if you're finding a lack of knee extension.
Alrighty guys, so what we're going to do first is show you at home how to check and see if you might be lacking knee extension in one or even both knees. So what I'm going to have here is Dr. John Mark get into what's called a long sitting position. With he's sitting upright, his legs are just straight out here onto the table. And so at first what I'm going to have him do is take both of his hands and see if he can slide them underneath the back of both of his knees. And so what he's going to be looking for is, hey, do both knees feel the same when I try to slide them underneath the back of the knees? So do you feel a difference with that?
Yeah, for mine, they feel pretty even for me.
Okay. So if you're feeling like it might be pretty even for you too, you can take it actually a step further and actually activate this big quadricep muscle here, which is going to force the back of your knee even further to the table. So I'm going to have him do that real quick. So he's going to squeeze that quad, try to push the knee
right here.
Yep, it's going to push the knee down flatter onto the table, and then you got to recheck and see if there's any difference there.
And you may be able to feel too if there's if your knee's doing pretty good, you should be able to feel the ground evenly underneath the back of the knee. It should be an even amount of space or lack of space under there.
Yeah, so we're looking for symmetry on both sides with this. So that's a really quick and easy test to see, hey, am I getting the same extension there on both sides? Is it limited? So on with that. So let's just say, for instance, that Dr. John Mark's left knee was a little limited with extension. There's a few things that we can do here in the clinic to work with that. We're going to demonstrate one right now. So I'm going to have you go ahead and lay back for me. And so when you're thinking about the knee mechanics, like he said last time, we talked about internal rotation there at the tibia. So whenever you're extending the knee, there's a little bit of what's called a roll and a slide that's occurring. And so you're looking at the tibia and how it's functioning while it's rolling on the femur. And that's really what gives you that extension. And if you're lacking, it could be because the joint itself is not moving properly, or even some soft tissue is tight and it's not allowing it to move to that full range of motion there. So I'll show you what I mean with this technique here. And so what I'm going to do, I'm just going to take this foam, half foam roller here. I'm just going to slide it gently here underneath the tibia. So if this is your knee joint, we're just slightly below the knee joint, and it's resting right here underneath the tibia. And so what I'm going to do is I'm just going to put my hand on the top of the knee here, and then I'm just going to give a slight force here on the top of the femur. And basically what we're trying to do is recreate the knee extension, and it's just really focusing all of the force right there at the joint. And we're trying to create that rolling mechanism from the tibia. So very nice and easy. What do you feel here when I'm doing this?
Yeah, I feel just a little pressure there at the knee. It's not painful. It shouldn't be painful. It feels like a good amount of pressure.
Good. So it should feel good. It shouldn't be creating any kind of pain there for you. And so I can actually, as we talked about last time, I can create a little bit more of a rotational element to this. And very soft there, getting some nice tibial rotation, mimicking what you would need for full knee extension. So this is one way we can do this. Good. And so with knee extension, sometimes you can actually get what's called knee valgus, which is meaning when you're standing up straight, your knee comes in a little bit. And so whenever you have that, it can really affect the mechanism of how the patella is working and overall really cause some added stress there on the inside of the knee. And so that's another thing that we really want to look at and work towards improving. And so something that we can really easily do with this is, I'm just going to sit here right here on the table. And so when your knee's coming in, basically what we're going to try to do is try to correct what's occurring there. And so I'll put my hand right here on top of the kneecap on the inside of the thigh, and a hand here below, and then just give a little bit of pressure, and then relax. So I'll do this a few times, and again, we're just trying to get the knee in a little bit better alignment. Good. And then what I'm going to have Dr. John Mark do is again squeeze this big muscle right here, which is going to get us in some knee extension, as well as creating a better knee alignment for that kneecap. Good. And how does this feel for you?
Yeah, it feels good.
Good.
So I'm just trying to straighten my knee now as Dr. Steven is creating a better position of the whole knee, really straightening out the knee. If this is a good technique if you're a little bit more not knee.
Good. Awesome. So obviously these techniques are going to be near impossible if you're at home and you want to make some improvements and start today and making those improvements. So 2 easy things that you can do is the first one being just doing what's called a quad set. It's essentially what Dr. John Mark was doing on his own, which is squeezing this big quad muscle, trying to flatten the back of your knee to whatever surface you're sitting on, laying on, right there. So you want to hold it for anywhere from 3 to 5 seconds to really get a good push, and then let the whole muscle relax. Good. And then another thing that you can do is try to really work the calf muscle. The calf muscle can be overlooked when you're thinking about knee extension, but the reason you want to look at your calf muscle is because it connects all the way and it goes above the kneecap. And so if it's short, it will limit your ability to fully get that extension. So something usually you can do is try to check yourself for any type of tightness and sensitivity there in the calf muscle, and just give yourself a little bit of a soft tissue work and try to work out that tightness and ultimately restore some lost knee extension. So I'm not going to work on his calf for free, but just demonstrating it for you. So those are 2 quick and easy ways that you can start to restore some lost knee extension at home on your own. Anything else you would like to add?
Yeah, that's it for today, guys. So check back in next week as we will be diving into some more knee help for you guys. Thanks for watching.